Hi, my name is Kristen Reponti and today I'll discuss the last two subtopics of cassette-based image acquisition. My assigned topics are printer artifacts and operator errors. So let's start with printer artifacts. So let's separate the two words first. So printer. Remember, this is not a printer that can be connected to a computer to make copies on paper documents or anything else. The printer we will use is an X-ray printer with laser imagery technology that generates X-ray film from digital data material. So next is the artifact. The artifact is referring to any irregularity of an image that is not caused by the proper shadowing of tissue by the primary beam. And also, it is an undesirable optical density on radiograph. So, printer artifacts is referring to the fine white lines may appear on the image because of the debris on the mirror in the laser printer. So, this is what it looks like. So, mo ni siya guys kani linya diri. Mo ni siya ang white lines. So, this oblique foot image demonstrates two different artifacts. The fine white line, kaning black arrow running parallel with the long dimension of the film is an artifact from the laser printer. The line running perpendicular to the long dimension of the film, kaning white arrow, is caused by dirt on the light guide of the photo multiplier tube in the plate reader. So, service personnel will need to clean the printer to avoid poor equipment performance that results in poor image quality and may lead to repeat imaging and therefore increase radiation exposure and cost. And now let's proceed to operator errors. So this refers to insufficient illumination result in an attenuated radiation striking the image plate. So the resulting histogram is changed so that it is outside the normal exposure indicator range for the body part selected. Using the smallest imaging plate possible and proper illumination, especially on the small or thin patients, eliminates this error. So as you can see the picture, so muna siya kalayan. So kaning picture A, so this is a properly illuminated lateral ankle. So while on picture B, muna siya improper illumination resulting in poor histogram analysis. So makita man ang kalahian dira. So yeah. Okay, next is if the cassette is exposed with the back of a cassette towards to the source, the result is an image with a white grid type pattern and a white areas that corresponds to hinges. Yes. So care should be taken to expose only the tube side of the cassette. So as you can see, the image, so na siya mga bagis-bagis ha. So this image, this axillary shoulder was exposed through the back of a cassette. So okay, reminder, so artifact remedy. Be sure radiographers are well educated about how to use the entire computed radiography system. Lastly, underexposure produces quantum mottle and overexposure affects contrast. So the proper selection of technical factors is critical to patient dose and image quality and to ensure the appropriate reduction of light from the imaging plate. So the picture on the left shows an underexposed image caused by insufficient milliampere seconds and the figure on the right shows an overexposed image caused by excessive kilovoltage peak, so resulting in quantum mottle and decreased contrast respectively. Remember, sufficient photons are necessary to form any X-ray image. Insufficient photons result in quantum noise or mottle. That's all.